Hi, my name is Lisa Pham, and today I will be presenting to you my capstone project. The title of my capstone project is A Quantitative Analysis of Misdiagnosis Children Correlating with Trauma. So here you have my poster. We have the abstract, introduction, methods, results, and discussion. So I will be just briefly talking to you about my capstone and how it went. So in recent years, a growing body of research has developed to examine the relationship between exposure to traumatic events in childhood post-traumatic stress disorder, which is PTSD, and attention deficit hyperactivity disorder, ADHD, oppositional defiant disorder, ODD, and anxiety disorder. It is not surprising that these areas are being evaluated, as cognitive and emotional disruptions that occur in response to trauma, such as difficulty concentrating, dysregulated affect, irritability, and hyperarousal, either overlap with these other diagnosis symptomology or exacerbate it. So according to the clinical directors at Correlating, there has been an increase in children, youth being misdiagnosed and mistreated with ADHD when instead they have PTSD. It is crucial to help people organize the difference between ADHD versus PTSD and anxiety disorder with oppositional defiant disorder, ODD. Understanding the symptoms, behaviors, criteria, and descriptions are very important to be able to differentiate the difference. So some research background on this topic, Turley and Oberzert emphasize the issue of children being misdiagnosed in children with ADHD instead of PTSD. While Jacob, Moreland, Zervig, Brown, Jacobson, and Whiteside discussed the variables that differentiated anxiety disorder from ODD. Jacob believed that understanding the different behavior variables can assist with common misdiagnosis with children. Misdiagnosis can lead to incorrect treatment and create other issues for the child later on in life. The goal of this intervention is bringing awareness and provide valuable information to family members about symptoms and behaviors of the four most common diagnoses in children. And this is imperative to my project because the focus of the project is to assist family members to become better advocates for their children. When it comes to diagnosing their children with a disorder, the project created an intervention that will help provide psychoeducation to parents. So the population that Correlating, which is where I implemented my project at, Correlating Children and Family Services in Pomona, they serve children and youth between the ages of 5 to 18 years old and their families. However, the population that the capstone project will focus on are just the parents and family members of Correlating, while extending it to the local community as well. Through providing psychoeducation to parents and family members, it is impacting the children and adolescents that have had experience or have been affected by trauma. Some of the services Correlating provide are family services program, foster care programs, wraparound services, and other mental health services as well. Through being informed, families will become more knowledgeable in recognizing certain symptoms and behaviors in the child to become better advocates for the children. Addressing the problem of misdiagnosing children through utilizing parents and family members are used as a tool to consistent with the NASW Code of Ethics 1.01, which states that the social worker's primary responsibility is to promote the well-being of clients. As social workers, the client's well-being is highly important. Therefore, by preventing misdiagnosis that can lead to wrong treatments and medication is crucial in keeping the client and their family well-being safe and secure. So we'll be moving on to the methods section. Here, I have divided the methods section into 4 different subsections. We have research design, sample, data collection and measurement, and data analysis. So in research design, the capstone project utilizes a quasi-experimental design to determine the causal impact of an intervention on the target population. A quasi-experimental design enables the research to control the who, when, and how, and what is measured. This capstone project will measure parents' knowledge of trauma and the 4 diagnoses before exposure to the psychoeducation and then after the exposure, which is 6 weeks. The outcome of the intervention will be measured through a pre and post test. A Likert scale will also be used as a short-term outcome to assess the intervention effectiveness. These assessments are used to evaluate if parents were able to gain any knowledge of trauma and its effect on children, as well as being able to distinguish subtle behavior differences in the 4 most common misdiagnoses in children. The assessments will be inputted into statistical package for the social sciences, which is SPSS, to analyze data gathered from the assessment. Then we have the sample. The study was conducted using a convenience sample of parents. Inclusion criteria included there's only 2. A parent caregiver of a child who is under 18 years of age, and B, 18 years of age or older. Interns will collect data from the participating parents who are referred by parent partner staff and Pomona School District. However, any parents or caregiver that are interested are welcome to participate, not necessarily have to be from Crittenton or from the school district. Data collection and measurement. During the first session, participants will receive a pre-test to assess their overall knowledge on these topics. After the last session, participants will receive a post-test to examine if they were able to gain any information from the psychoeducation. Part of that last session, a Likert scale will be used as a short-term outcome to assess the intervention effectiveness. Quantitative questions will be used to measure the effect of the psychoeducation on parents' knowledge of trauma and diagnosis. The Likert scale questionnaire consists of 12 questions, 2 questions per topic. The topics covered are baseline of child development, trauma, trauma in relation to minorities, ADHD versus PTSD, ODD versus anxiety disorder, and then last is self-care. Prior to the questionnaire, there will be an assessment to verify participants' demographics, where participants can identify their age, ethnicity, spiritual, religious preference, sexual orientation, child's age, and relationship status. The readability report for this questionnaire is 49.6 for the Flesch reading ease, 9.3 for Flesch Kincaid grade level, and 0% for passive outcomes. And lastly, we have the data analysis for the methods. All statistical analyses were conducted using SPSS for Windows version 24. Descriptive statistics were calculated to determine means and standard deviation for continuous variables and for frequencies and proportions for categorical variables. Parity tests were conducted to determine whether there are differences between pre- and post-test scores on the misdiagnosis of children correlating with trauma psychoeducation. Results were considered significantly significant if p equal less than 0.05. And then we'll be moving to the results section. Here I have provided some graphs for you to see as you follow along, but it's basically talking about the demographics and then how the results of the pre and post test came out. The sample consisted of participants that are identified as parents and or caregivers. 4 participants were included in the study with 100% response rate. Half of the participants ranged from 35 to 44 years old. Of the total, 100% were female. They were also, a female. 50% of participants' annual income were $20,000 or less, and 100% were of Latin or Hispanic ethnicity. The baseline characteristics of the participants are presented in Table 1. We have the gender, ages, income, ethnicity, and so forth. The responses of questions were captured in 5 categories: strongly disagree, disagree, neutral, agree, and strongly agree. The results indicate moderate effect of psychoeducation in enhancing participant knowledge of the behaviors and symptoms of ADHD. While there were substantial effect of the psychoeducation on ODD increase in knowledge at post-assessment level. There was a moderate significant improvement in the number of increased knowledge from the pre- and post-test surveys, as it shows on Table 2.1. The T-score for the post-assessment was negative 7.35 as a degree frequency is 3, and the p-value was less than 0.05. To test the hypothesis, the parenting group psychoeducation sessions intervention would improve knowledge of behaviors and symptoms of ADHD, PTSD, ODD, and anxiety disorder. A sample t-test was conducted between pre-test and post-test, with the pre-test mean of 12.25, standard deviation of 3.77, and the post-test of mean of 23.50 to the standard deviation of 1.73. A statistical difference in scores was found, supporting the hypothesis. Detailed results and graph are presented in Table 2.1 and 2.2. As you can see here, this is the mean for the total of the pre-test score, and here is the total for the post-test, and there, as you can see, there is an increase. And then lastly, we have the discussion, conclusion area. A few studies have been conducted on the topic of misdiagnoses in children regarding their mental health. The purpose of this study is to bring awareness to parents about the symptoms and behaviors of the 4 most common misdiagnoses in children, in hopes that parents can become better equipped to advocate for their children. An interactive presentation was presented to participants, and the intervention and pre-test and post-test knowledge was analyzed to support the research. It has been found that there has been an increase in children being misdiagnosed. As Turley and Orbsit emphasized, the increased issue of children being misdiagnosed in school with ADHD and PTSD. These 4 diagnoses that the intervention focuses on have several similar symptoms and behaviors that is one of the main causes of misdiagnosis. Further concerns include how misdiagnosis can lead to incorrect treatment and create other issues for the child later in their life. However, there's hope, according to Jacob. They believe that understanding the different behavior variables can assist with common misdiagnosis within children. Based on the results of this research, participants entered the course without much prior knowledge of the symptoms and behaviors of ADHD, PTSD, ODD, and anxiety disorder. However, the post-test result confirmed that participants graduated the course with increased knowledge of the topic. Therefore, findings of this project are consistent with the literature. The mission of Quantitative Services for Children and Families is to help heal the wounds of abuse and neglect, to strengthen families, whether birth, foster, or adoptive, and to help troubled adolescents reach their full potential. In increasing parents' knowledge of symptoms and behaviors of most common diagnoses in children, encourages parents to become better advocates for their children and may prevent further trauma to their children if misdiagnosed and mistreated. Encouraging parents to become better advocates can help achieve the agency's mission by strengthening families and helping heal wounds of abuse and neglect. As helpful as this intervention may be, there are still implications that exists. A practice implication for this agency and other agencies similar is the low turnout rate. Even with months prior of advertising and phone calling, there was a low turnout rate. The courses were offered twice a week at different times in hopes to grab more participants. However, only one of those days were utilized due to the low turnout rate. This intervention has many strengths, one of which is teaching parents the importance and skills of being an advocate for their children or self. The empowerment was brought to those parents who are going through difficult times is a strength in itself. The role-play activity is another strength that encourages participants to challenge themselves and to apply their knowledge. In the aspect of implementation, there were limitations in incorporating the faith-based perspective. Due to the agency's policy, the topic of religion and faith cannot be discussed unless the participants self-disclose and engage in the topic of religion and faith on their own free will. Another limitation that arose from the difficulty of engagement between participant and intern was the language barrier. In the project design, a Spanish translator was also offered. As a Spanish translator was greatly used and appreciated, it was still difficult to build relationships and engage with participants to explain the topic fully when there is a language barrier between the relationships. And that sums it up for the my capstone project. Thank you for your time and listening to my presentation, and I hope you enjoyed it as much as I enjoyed implementing it. Thank you. Have a nice day.